Hey y'all, so in today's video, I want to share with you how to master your pharmacist interview at a hospital. So I've worked at a hospital for over 2 years now. I have some experience in interviews, and that's why I want to help you all out. For those of you who are transitioning and you got an interview, congratulations. Now let's help you secure that job, okay? So the first thing that I'm going to share is this is not retail. This is not wherever else that you're coming from. So please, you have to understand that this is a different playing field. So you have to be mindful of that in going into this interview, that there's information that you need to have access to. You need to study a little bit and you need to do your homework. So you need to have time to prepare. If you're looking for a job, you need to be preparing and thinking about these things. And that's why I wanted to make this video, so that way as you're looking, that you're preparing as well. Two, in retail, because I've worked in retail, a lot of times I'm not calculating a patient's creatinine clearance to determine if their antibiotic is a sufficient dose for them, because I don't have access to that information. But this is stuff that you're going to need to know when you work in a hospital before you're verifying medication for a patient to get in-house. So it is important, if you, even if you just graduated or if you have been working for a little while, go back and study your antibiotics. Antibiotic information is very important. Every hospital is different and they do their antimicrobial stewardship differently. Some places only the clinical pharmacist does it. Some places the pharmacists do it. At my hospital, we do have a clinical ID pharmacist, but we also have to intervene on patients' creatinine clearance, message the doctor, have them change it. So that's really important to know. Even at my job, see what's going on with the patient before we're verifying medication. So this is really important. Now, you don't need to know everything. When I first had my interview, I literally just passed my boards, which was a good thing because I had all the information about antibiotics, all that stuff in my brain, because they did ask me some questions on it. So things to study or to look over: antibiotics, cardiology, antibiotics, I mean infectious disease, cardiology, diabetes, and kind of like emergency medication, pediatric stuff. So the reason why I say this is because I remember just getting questions on if a patient comes into the emergency room and the doctor gives them these 2 antibiotics, is that appropriate? So these are some things to keep in mind when you're studying. It's not to just study to just know information, but to study real life examples. I would go through questions and just kind of think about okay, study what are the most empiric therapies for antibiotics. That's what we get a lot. Empiric therapy. So if a patient comes in, a lot of times they're gonna give them vancomycin and Zosyn. It's empiric, right? But now the question is okay, but what if the patient's allergic to this? Now, this is where things can get tricky, and this is where I really want you to be mindful of how you're studying. Now, textbooks say one thing, real life is another thing, okay? And this is why I want you to be mindful of this. So when you get certain questions that might be an example, it's not going to be textbook oh, what is the dose or the treatment for this? If this, no. It's going to be hey, so the doctor wants to order this, the patient's allergic. What are you going to do? This is what I would say. I would say, well, first I would look at the allergy. What is the reaction that the patient has? When was the most recent reaction? Was this when they were a baby, when they were little? And have they had that now that they are a grown adult? Depending on what the reaction is, I will just explain to the doctor, hey, this is a potential reaction of this medication. Do you still want to move forward? And if the patient had something of hives, sometimes they'll post allergies as I had an upset stomach. You can explain to the doctor, this is what the reaction was. It's not a matter of what the answer is, but it's how you go about getting to the answer. That's what these jobs are looking for in a hospital. So a lot of times it's not oh, well, they said the wrong antibiotic. They said that, no, because a lot of that stuff can be learned and taught. It was for me. A lot of hospitals have different procedures and different protocols, so they can't really hold you to this is what it is. I mean, obviously, if it's something very apparent, that you should know, then, but it's how you answer your question. A question that I've gotten multiple times in interviews has been, hey, you notice that this dose is off. You notice that this is wrong. The doctor still says that he or she wants to continue. What would you do in that situation? I've gotten this question a lot. And okay, by a lot, by 2 times, but still more than once. And my answer always has been, I will express to the doctor my concerns and my findings on why I believe that this is maybe not a right dose, maybe a not appropriate for the patient's age or their renal function or what have you. And I would also listen to what the doctor is saying and their reasoning, because I don't have all the answers. So there must be something that I'm not aware of that maybe they might think is more appropriate, considering that they are the provider. They have looked at the patient, they've looked at they've done a full workup on the patient, so they have more information than I do. And if I think based off of their reasoning that that's appropriate, then I will continue and I will come into agreement with what they're saying and verify the order. Now, if I think that the answer is not appropriate, then that is where I will try to escalate the situation. Maybe reach out to another colleague or maybe reach out to a manager and express my concerns. One, to see if this is maybe something that has been done before, and maybe this is just something that is just not necessarily on the resources, and two, so that way maybe conversations need to be had about what is going on when a patient comes in with X, Y, and Z, and doctors are doing this, which is contrary to what the protocol is, right? So that's how you need to be answering questions. There's no yes or no. What would you do in the situation? They're not looking for the right answer as far as like, oh, well, if the doctor is saying that the patient can't get this dose of Enco, then that's wrong. I'm not verifying it. No, but you need to kind of show that you're open to listening, and that you also need to show that you're also open into making sure that you're advocating for the patient. At the end of the day, that is everyone's goal, right? To advocate for the health and safety and well being of the patient. So that's how I want you to be thinking in your mind when you are going into these interviews, okay? I'm giving y'all golden nuggets, so I hope y'all taking notes. So the next thing I'm gonna say, I don't know what number this is. Is this 3? Is this 4? I don't know. Just take it. Um, your resources. A lot of times if you're asking a question and you don't know the answer, that is okay. Especially if you're going in with no hospital background, they're gonna be understanding of that. Like, oh, this person doesn't have a hospital background, but in a case that comes up and they have a question, what resources are they going to be utilizing? And so if you're not sure of an answer, you can say, that's a good question. I'm really not sure of what the answer is. But what I would do is I would search on up to date, whether it's a disease state or whether it's the drug, and I would look to see if that dose is appropriate. I would look to see if that's appropriate. And now that's like all good and well, but a lot of your resources. Don't just know up to date lexicon micromedics, but why would you choose one over the other? Now, you would say if it's pediatric, I would choose micromedics because they have a neofax option. They have a neofax where you can look up neonatal dosing and pediatric dosing as well. They also have a dosing calculator. They also have a Trishul's IV comparison where you're able to double check if a patient is getting one IV bag and they need to utilize 2 different bags, but they're using a Y site. So are those drugs compatible for this patient? So you need to understand what each resource has over the other. So that way when you're answering questions, you can say, well, I'm not sure of the answer, but I would utilize micromedics to double check if those 2 drugs could be used together. I would check on micromedics if I needed to check a pediatric dose or of some sort. So know your resources, Lexicomp, micromedics, up to date. What are the differences between them? And also they have like I think the Harriet Lane book, like things of that sort. Like just make sure you know your resources, and I think that'll be really golden, especially if you're coming from retail and you don't have much background in hospital pharmacy. These are the resources that we use all the time. So you mentioned that is going to set you up in good shape to be able to show those interviewing you like, hey, okay, you know what, they may not know everything and we can teach them the protocol. We could teach them the procedures that we have here, of course, no problem. But if they get in a situation where they can't readily access someone who's like sitting next to them, a colleague or something, what would they do? Like, what would they do? Are they utilizing the right resources? Or are they just going to Google it? you know? So don't say Google. Please don't say Google. But so that's my advice to you. I'm trying to think of what else. Of course, like with any job that you're having an interview for, everyone is looking for a team player. Everyone is looking for someone that can work well with others. You will get those questions of like, what would you do in conflict? Always make sure that you show that you are open and that you are a team player. You know, if I realize that maybe one colleague is not putting in the work that needs to be done, you could just say, hey, like, I'm here to help as well. Is there something that I can do to take off your plate to help you get this task achieved? Because at the end of the day, it's about patient care. So you want to just make sure that you're showing them, like, hey, I'm open to be a team player, I'm open to work. At the same time, I'm also open to speaking up. If I realize that something is not right, or something is not benefiting a patient, or something is just not right overall, always making sure to say something to the appropriate individual who needs to know this information. So that's what I wanted to share. There could be so much more, and maybe I might add this to my or maybe I might just make a new one. I have a pharmacy school survival guide. Maybe I should just make a pharmacist survival guide, right? Like, how many of y'all would want that, where I like have videos that you can purchase, and I have like resources in there that you can purchase, that you can have, you can watch it over, you can have the download the PDFs or documents that I put in there. And if y'all didn't know I had a pharmacy school survival guide, then you should check that out, especially if you're in pharmacy school. I will link it below. But maybe I'll make a pharmacist survival guide, because I have like so many things in my head that I'm like, oh yeah, do this, that pop into my head all the time. So when I'm sitting down and making a video, I'm like, oh wait, I forgot. So maybe I'll just make like a whole survival guide that y'all can have as your resource and use it to prepare. And I even also have where you can do schedule an interview with me, a mock interview, so you can practice. Um, I know that one is geared to pharmacy school, but I believe it should still work if you want to practice doing your interview with me for pharmacy. If you're doing a hospital pharmacy, or if you're doing like long-term care pharmacy, because I work in a rehab, and I currently work at a children's long-term care facility. So, you know, I have certain experiences that I'm more than happy to share and work one-on-one with you. So you can click the link in my bio. I believe you still should be able to still schedule like a mock interview. It doesn't necessarily have to be like for pharmacy school. So if you do it, then we can set up a Zoom time to meet. And yeah. So I hope that you found this video helpful. I wish you all the best on your interview. Remember, I always say this in all my videos, wherever God needs you to be, that's where you will be. So trust that wherever that He is leading and directing you, that it is yours. Have that confidence in Him and trust Him. So you already know the deal. You can comment below, or you can email me at behismasterpiece@gmail.com. Go out, be kind, be caring, be loving, and as always, be his masterpiece. Bye, y'all.